I be trying to find. Okay, let's try this. Okay. Nope. That's not gonna work. That's not gonna work. What about this? I'm just sitting here trying. What about this? Nope, that's not gonna work either. What about this? Okay. Let me stop. What's up, y'all? How y'all doing? Okay. Welcome. I guess you can think about this as our first pep rally / NCLEX Arcade Jeopardy. So welcome everybody. If you do not know who I am the Muffin Man. Do you know the Muffin Man who lives on Drury Lane? It's me. But hello, I am Nurse Sam. I am coming here today for another game of NCLEX Jeopardy. Okay, but this is going to go hand in hand with our Back to Nursing School pep rally that we have. It's going to be it's our 4-week pep rally, so this is going to fall right in line. So throughout the month of September, every NCLEX Jeopardy is going to be is going to go hand in hand with whatever theme or topic or lesson plan that we're focusing on for that week. So this is week 1 of our brand new Back to Nursing School campaign. And that is to help you guys get hyped and prepared for nursing school. Okay, it does not matter if you're an RN, LPN, you need to be here. You need to be here, my love. Okay? Lauren, NCLEX Arcade, help me pass my NCLEX. Boop, boop, boop. Period. All right, so I'm going to bring it up. 1 second. All right, so this is what we're doing today. NCLEX Jeopardy. But our topic is going to be nursing skills, basic care, and medication administration. Okay? A lot of people skip this because it has the word like basic in it. So you think that you need to like skip this. It's going to be really easy. Don't get got. Do not get got. Okay? Because even I was going through it and I was like, I don't know. So, I'm already in week 4 of nursing school. Ooh, love. It's okay. That means if you're already in week 4 of nursing school, if you've already started, that just means that you're already on the game. This is either going to be a good review, or you're going to learn something new today. Okay? All right. Hold on 1 second. So let's go ahead and get started. All right, so if you have any questions, just let me know. Drop it down below. If this is your first time playing NCLEX Jeopardy, welcome. You do not need to be in your first semester of nursing school to be here or to play this specific game. Like I said, either you are reviewing this information or you're learning it for the first time. It's perfectly fine. All right, so let's go ahead and get started. I'm going to put up the question. You can see the question, the answer choices. We're going to have some select all that applies because I want to get y'all familiar. I want to get y'all ready for that. I don't think we have any fill in the blank, not this time. Like I said, we're focusing on nursing skills and procedures, basic care, and medication administration. All right. Hello, my first timer is Vonna G. First school starts Monday. Ooh, good luck, love. Good luck. All right, so let's go ahead and get started. I'm going to bring up the first question. Remember, this is NCLEX Jeopardy or nursing school Jeopardy. You don't have to, well, let me say this. If you are about to start nursing school or if you've already started nursing school, no matter what semester, I always recommend that you start studying for the NCLEX, so start preparing for the NCLEX day one. Do not wait till your last semester to start getting into the NCLEX mindset. Okay? All right, so let's go ahead and start it off with skills. And then this one is select all apply. Okay? Quick little side note. When I do put up the question, read through the answer choices. When you answer, because this is NCLEX Jeopardy and it's Jeopardy style, you have to put what is before your answer in order to get those points. All right, so if your answer is going to be the second option, the third option, you have to say what is 2 and 3, or what is 2, 3. 2, 3, whatever. But that's for select all that apply. So just make sure you put what is before it in order for it to count for the points. Now, I'm always going to say this, okay? I can only go by what's on my screen, just in case there's some connectivity issues, whatever. I can only go by what's on my screen. So if I'm saying who the winner is, I'm going by who shows up first on my screen. Just in case you have a different person that shows up on your screen, I can't see his screen. I can only see mine. So that's going to be the winner of those points, okay? Now, we play for about an hour. We play like roughly about 10 questions. So it can be literally anybody's game. Points are going to range from 100 points to 500 points. Whoever has the highest amount of points is going to win a free Ultimate Nursing School bundle. All right. That's the 400-page bestseller. You're going to need that, especially for our Welcome Back to Nursing School campaign that we have going on. We're going to touch on different study kits within that bundle throughout the month of September. All right, so if y'all are ready, give me a thumbs up. Wait, hold on. If you're studying for T's, T's is Tuesday. All right, T's for Tuesday. All right, so I have a thumbs up, so 2 thumbs up, so we're ready. Awesome. Let's go ahead and get started. All right. And first question, skills for 400. This is select all that apply. Please know. All right. You do not have to wait for me to read it in order for you to answer. If you read through it, you know the answer, go ahead and do your thing. Okay. All right. So skills for 400. The nurse is caring for a client who takes ibuprofen for pain. The nurse is gathering information on the client's medical history and determines it is necessary to contact the primary healthcare provider if the client is also taking which medications. Select all that apply. Okay. 1, warfarin. 2, glimepiride. 3, amlodipine. 4, simvastatin. Or 5, atorvastatin. Okay. I always recommend that after you read the whole thing through, go back and at least read the last sentence so you know and you're reminded of what the question is really asking you. Not what you think, what you made up in your mind. Okay, guilty of it. A lot of people are. So, word of advice. Let's go back and read that last question. The nurse is gathering information on the client's medical history and determines it is necessary to contact the primary healthcare provider if the client is also taking which medications. Select all that apply. All right. So first things first, whenever you see select all that apply questions, it's usually going to be more than 4. Okay. It's usually going to be about 5 or 6. All right. And you know, now on the T's, they have select all that apply as well. So they're getting you ready. So another term for select all that apply is a multiple response, okay? And the thing with multiple response / select all that apply is that it can be as little as 1 correct answer or as many as all, okay? So here we have 5 answer choices. It can be as little as 1 of them that's correct or as many as all 5, all right? It's up to you and your comprehension in order to determine which ones are correct, okay? Now, if the question here says, as we are gathering the client's medical history, we determine that it is necessary to contact the primary healthcare provider if the client is taking which medications. What that basically means is that, like, whenever you have to contact the primary healthcare provider after reading over something, you're calling for clarification. Okay? So without saying, hey, to clarify, that's what that means. Whenever you see that, you're looking over something and it's necessary to call the doctor or call the provider, it could be a nurse practitioner, physician assistant, whatever, and ask for clarity. Okay, when you're looking for clarity, it means that these 2 things aren't supposed to be here. Like, I'm kind of second guessing this. Let me just call for clarity. Are you sure these 2 are supposed to be together? All right, so whether that it causes unwanted side effects, maybe they're contraindicated, that's usually the thing that's going to make you clarify. Anything that can cause harm to the client in any way, that's why you need to clarify. Okay, so let's go ahead and see what this answer is. This is skills for 400, and the answer is, drum roll please. Let me get my handy dandy notebook, aka scoreboard, out, and the answer is What is 1, 2, and 3? 1, 2, and 3. Okay, 1 was warfarin, 2 was glimepiride, 3 was amlodipine. Okay? Warfarin, glimepiride, and amlodipine. Those are the 3 that if you see a patient is taking ibuprofen and these things, you want to get clarification, and here's why. Okay? NSAIDs, or non-steroidal anti-inflammatory drugs, which is ibuprofen, okay? Those can amplify effects of anticoagulants, which is warfarin, all right? Those medications should not be taken together, all right? So ibuprofen, which is an NSAID, and an anticoagulant, such as warfarin, should not be taken together. That we need to clarify that, okay? Next thing, hypoglycemia may result for the client taking ibuprofen if the client is concurrently, aka at the same time, taking an oral anti-diabetic agent, such as glimepiride. I want y'all to read that back one more time, okay? It's important that you note each and every word, because words mean things, okay? Now, if this was that same sentence, for example, if this wasn't, if they said they were taking maybe an injectable anti-diabetic agent like insulin or something, that does not apply, okay? It specifically says when taking an oral anti-diabetic agent, okay? Glimepiride is that oral anti-diabetic. That plus ibuprofen can cause hypoglycemia, your blood sugar to fall, okay? Those should not be combined. So once again, clarity. Next thing, a high risk of toxicity, okay, exists if the client is taking ibuprofen concurrently with a calcium channel blocker, such as amlodipine, all right? Therefore, this combination should be avoided, okay? Now, remember, whenever you see, especially when it comes to pharmacology, if you need to identify the class, in which a lot of times you will need to do, because you may not know the specific type of medication, but based off suffixes, you'll be able to kind of guess or deduce what specific class it belongs to, so you can go ahead and make your decision based on that. All right? Dipine, the suffix D-I-P-I-N-E, represents calcium channel blockers. And like we said, a high risk of toxicity exists if you mix calcium channel blockers with ibuprofen. All right, so don't do that. The last 2, atorvastatin and simvastatin. There is no known interaction between like NSAID, specifically ibuprofen, and simvastatin or atorvastatin. Those 2 are anti-hyperlipidemic agents. All right, they lower your cholesterol. Whenever you see a statin, okay, you want to think cholesterol, anti-hyperlipidemia. All right, so there's no interaction between those 2. All right, who got 1, 2, 3, and 4 correct? Let me know if y'all have any questions and if that made sense. All right, 1, 2, 3, and 2 and 3 is the answer. I'm scrolling up. A lot of people chose 4 and 5, which was, like I said, the statins. Two different things. Whenever you see 2 answers that are either the same or opposite, they're either going to be the answer, part of the answer, or they're not going to be. Okay? So just keep that in mind. Let me see. What is 1, 2, 3? Let me see. Now, another thing with select all that apply is that there is no partial credit, at least for this version. I know that in the new generation, next generation NCLEX, they're going to give you guys partial points. That's not till like mid 2023. But for how it is now in the format, the format it is now, it's either all or nothing. You either get them all right or the question is wrong. That's why everybody hates select all that apply. There's like no leeway, no grace at all. I'm just looking for 1, 2, and 3. Okay, Danielle Monica. Okay. Danielle Monica, I think, is the only person that got it. Ooh, give me some snaps. All right, Danielle Monica. You're on the scoreboard with 400 points. Great job. You are the only person to get that one correct. So, pat yourself on the back. If you didn't get it correct, No biggie. Like I always say, I would rather you guys get it wrong with me during this little review than on the actual NCLEX. You agree or disagree? Okay? You can get it wrong with me all you want. She doesn't care. She gets it wrong. Okay? That's why we learn. If we do get something wrong, we go over the rationale so that you can understand why you got it wrong. So that when you see this same content area, or if you see this a similar question, you now know. Okay, I've been here before. It got me once, but it won't get me again. Okay, that's what you want to do. All right, so Danielle Monica 87. You won the scoreboard with 400 points. Awesome job. All right, next question. What was that? Skills for 400? Let's go ahead and do... Oh, no. Basic care. Basic care for 200. All right. The nurse is prepared... I'm not home. I'm at... As y'all can see, whenever y'all don't see this polka dotted wall behind me and I'm in my office, I'm somewhere else. Okay? But I still come and I bring y'all this tea. Okay? I bring all y'all NCLEX Jeopardy no matter where I am, even if it's another time zone. All right, basic care for 200. The nurse is preparing to insert a nasogastric tube into a client. The nurse should place the client in which position for insertion? Is it 1, right side, 2, low Fowlers, 3, high Fowlers, or 4, supine with the head flat? Okay. Make sure you say what is. This is NCLEX Jeopardy. I'm going to put that here, actually. 1 second. Make sure you say what is prior to answering in order to qualify for points. Post. And then I'm going to pin this at the same time. Pin. All right, perfect. All right, positioning. Let's go ahead and see what our answer is. A lot of people saying 3, which is high Fowlers. All right, we're preparing to insert a nasogastric tube or an NG tube. How do we want that client to be positioned in order for us to perform that procedure? Let's look and see what the answer is. What is 3? High Fowlers. Pat yourselves on the back because a lot of people got that one right. All right, let's go ahead and see who got it right first, though. Who got it first? AJ ran it up. Okay. All right, AJ ran it up. AJ ran it up. You won the scoreboard with 200 points. Awesome job. All right, who else got it? Remember, it does not matter on the actual teas. On the actual NCLEX, it doesn't matter who got it first. Okay, stop. It keeps like... All right, I'm gonna put that there. It doesn't matter who got it first, as long as you get it correct and within the time frame that's allotted, you're good. Okay, just because we're playing for points and an incentive, that's the only reason why it matters who gets it first. It just makes it fun, a little friendly competition. But for everyone that chose what is 3, on the actual NCLEX, you would have got that right, boo. Small wins, okay? Who else got it? Kiss My Dimples, Kunda Lineky, TGDC, don't forget to say what is, Anna Mac, Amaris Patrice, Mary, Priyanka, Antoinette, Idanagram, who else? Corey, Estoff, The Sharon Show, Shanice, Elizabeth Iman, Lauren. Look at y'all. Topical bath body, this was not select all that apply, so you just have to choose one. All right, so great job to everyone that got that. Rationale says, during insertion of a nasogastric tube, the client is placed in a sitting or high Fowler's position to facilitate insertion of the tube and reduce the risk of pulmonary aspiration if the client should vomit. The right side in low Fowlers and supine positions place the client at risk for aspiration. Okay, if y'all know what aspiration is, make sure you need to know that word. In order to, especially when it comes to like basic care, skills, procedures, all that stuff, you need to know what aspiration is and how to prevent it. Because once again, the theme of NCLEX, y'all know I love my themes, but NCLEX actually has a theme, for real. And the theme of NCLEX all the time is client safety, all right? So you're gonna always want to choose the answer that makes the client the safest, depending on what, it's asking you or whatever, but you always wanna avoid any type of injury. Aspiration is something that can be prevented, especially when it comes to positioning. So in a lot of these procedures, it's going to ask you, do you know what proper position to put this patient in? Because you can prevent a lot of harm by just knowing what proper position to put somebody in. All right. It's kind of common sense. If you are eating, if you're drinking liquids, do you want to be up high or do you want to be laid down? Like this what we look like drinking. Girl, you finna aspirate. You are finna aspirate. Don't do that. Okay, so positioning is very, very important. I gave points. Yes, I did. All right, next question. Let's do this. Administration. I'm gonna say administration. Med administration for 300. The nurse prepares to administer an intramuscular injection to a 4-month-old infant. The nurse selects which best site to administer the injection. 1. Ventrogluteal. 2. Lateral deltoid. 3. Rectus femoris. Or 4. Vastus lateralis. I'ma be a gallus, my vastus lateralis. What I'ma do? A lot of people saying 4. A lot of people saying 4. Okay. I'm gonna remix gallus, and then make it vastus lateralis. Cause I want she and she and she. All right, a lot of people saying vastus lateralis. All right, let's go ahead and see what our answer is. I'm going to give y'all a couple more. You want to give yourselves about a minute to read and answer the question. All right, try not to second guess yourselves and change your answers, because more often than not, you most likely get it wrong if you change your answer. All right, so let's go ahead and see what the answer is. Vastus lateralis. What I'ma do? That's gonna be stuck in my head. What's this again? No, wait, that's not it. Oh no. Okay. The answer is what is 4. My love bugs. What is 4? Okay. What is 4? Vastus lateralis. All right, so intramuscular injection sites, or intramuscular or IM. Okay, those are selected on a few different things, but it's selected on the basis of the child's age and the muscle development of the child. Okay, the vastus lateralis is the only safe muscle group to use for intramuscular injection in a 4-month-old infant. Okay, the sites that were like 1, 2, and 3, those were unsafe for a child of this age. So, big tip, whenever you see questions like the one we just saw, it's asking you what position to do a specific type of injection, I want you to note a few things. Note what type of injection. Is it a sub-Q, IV, IM, intradermal? What type of injection is it going to be? Okay, another thing that's going to play a part in is almost like the volume of it. So sometimes they may give you the volume, sometimes they won't. All right, if it's a large volume of solution that's going into a specific muscle. So who's trying to piss me off? But if it's a large amount of solution going into a muscle, you have to make sure that the muscle can handle that much fluid. So that will determine the site that you choose. Now, the question said IM injection, so step 1. And then it said it specified the age of the child. Another tip, whenever you see nursing school NCLEX questions and it specifies either like the sex or the age, pay attention to that. Okay, they didn't say, you're doing an IM injection on a 74-year-old man. They didn't say that. They say a 4-month-old infant. Words mean things. Okay, they're not trying to trick y'all. They're trying to give y'all enough information so you can make a well-informed decision. Okay, and pick an answer. So 4-month-old infant, that played a big part. Okay, so the vastus lateralis is the only safe muscle group to use for an IM injection. Step 1, and then for an IM injection for a 4-month-old. Okay, so the answer is, what is for vastus lateralis? First person to get what is for is, one second, wait for it. Nay 42. Okay, Nay 42. Hold on, how many E's you got? 3 underscore 42. All right, so you are on the scoreboard with 300 points. Awesome job. Who else got it? It's Lexi, Mary SWBC, Buchanan, Amaris, Wallflower, Singh, Avatar, Tayana, Lydia, Sidner, Ida Ingram, Antoinette, Tropical Bath Body. Oh, and then Sing Avatar came back and gave me the rationale because it's a bigger muscle. Lauren, great job. All right, next question. Do not fall. It's gonna fall, right? Because I said that too. What was that? 300 points, med admin. Cool. All right, next one, basic care for 100. All right, when you think about basic care, you want to think about your vital signs. Okay, this is literally basics. Okay, you cannot do any type of critical thinking without knowing the fundamentals, the basics, all that stuff, because you have to obviously base that knowledge on something. So you need to know basic things like vital signs. You need to know how to assess something, all these things. You need to follow the nursing process, add pi, we'll talk about it, and then answer. Okay, so basic care for 100 points. The home health care nurse is caring for a client with cancer who is complaining of acute pain. The most appropriate determination of the client's pain should include which assessment. Whenever y'all see the words most appropriate, I want y'all to picture my face being dramatic and emphasizing it. Most appropriate. Picture my face doing that, okay? So it can just burn into your brain. The most appropriate determination of the client's pain should include which assessment? 1, the client's pain rating. 2, nonverbal cues from the client. 3, the nurse's impression of the client's pain. 4, pain relief after appropriate nursing intervention. What's going to be the most appropriate determination of the client's pain? Okay, what is our answer? Is pain a vital sign? Yes or no? Comment below. I pull up this answer. Is pain a vital sign? Yes or no? What is this again? This is basic care. It surely is. It is basic care. All right, and the answer is, drum roll please. Thank you. First of all, the answer is, what is 1, the client's pain rating. 2, pain is a vital sign. Absolutely. Sing kind of answered it, but I'm gonna ask y'all, is pain, even though pain is a vital sign, okay, pain, the vital sign, is pain subjective or objective? Is it subjective data or objective data? Answer it right now. Is pain subjective or objective data? Is pain subjective data or objective data? Absolutely. Pain is subjective. Okay? Pain is subjective. Just like AJ said and Sing earlier, pain is whatever the patient says it is. If you ask that patient, what is your pain? And they say 11, on a scale of 1 to 10, what's your pain? And they say 11. There's not a place for you to put 11, but you you have to record it. You're going to have to put it in your notes. Okay? The pain is whatever the patient says it is. Okay? It says the client's self-report is a critical component of pain assessment. All right. The nurse should ask the client to describe the pain and listen carefully to the words the client uses to describe the pain. You got to record all that too. Okay. Don't go and put your own spin on it. Don't go and summarize. Absolutely not. When they're describing pain to you, you better put some quotations and say, client describes pain as. If they say it feels like a million ants are biting off my foot, guess what you got to put? Not 1,000,001, not 1,000,002. Not 999,000, a million ants. You got to put it. Whatever they say that pain is, you got to take it for face value. That's what it is. It's subjective. Subjective to what they say it is. Okay. It says nonverbal cues from the client are important, but those are not going to be the most appropriate pain assessment measure. Okay. Give me some examples of nonverbal cues as far as pain goes. Oh, okay. Kiss my dimples. Facial expression. Okay, facial expression, absolutely. Nonverbal cues, okay? How can we assess that they're in pain, or what's going to let us know that they are maybe in pain? We may not know how much, but it's going to give us a clue as to how they're feeling pain-wise based off of nonverbal cues, okay? They're not telling us, but just what we see and assess. So facial expressions, grimacing, absolutely. Guarding, yes. Squinting your eyes. See, me squinting my eyes because I'm blind, but it depends. Crying. That's a good one. Crying. Clutching the fist. All that. Yeah, I got you, Trev. In response to someone's question about why wouldn't it be objective? Absolutely. Doubling over. BP high. Pulse is high. Those are all nonverbal cues to let you know as the nurse that this patient may be in pain. So that's when you would then ask them, hey, are you in pain? What would you rate your pain? How would you describe your pain? That's when you can go and take, the next step and to get their self-report and to get their own reporting of the pain. What's the next thing? It says the nurse's impression of the client's pain is not appropriate in determining the level of pain. Okay, just because this is a really big one, especially within like women's health. Somebody comes to you, or this a big one is like ER and like back pain that you cannot see physically. So it's not like they came in with they arm missing, something like that. And we're like, oh, this looks like it's gonna be a lot of pain. Sometimes they come in, maybe their appendix bursts, but you can't see that on the inside, love. So you have to use those nonverbal cues. You have to use what they tell you the pain is to then assess and then make whatever nursing intervention you need to do in order to get that patient comfortable. Okay? So assessing pain relief is an important measure, but this option is not related to the subject of the question. Remember to always answer what the question is asking you. All right, so who said what is one first? Let's look and see. Oh no. Jaw clenching. Awesome job. Who said what is one first? Scrolling up. I think it was, hold on, Nay 42. All right, Nay 42 again. So you were already in the scoreboard with 300 points. You just got another 100 points. So now you have 400 points. And you are tied with Danielle Monica with 400 points. And then we have AJ ran it up with 200 points. It can still be anybody's game. We still got some time. Okay, who else got it? Amarise, TGDC, Shawnee's, AJ Ran It Up, Buchanan, Kiss My Dimples, Priyanka, It's Callie, Wallflower, Vicky TTS, Blessed Favorite Beauty, Mary, Uniquely Flawed, Sangeeta, Tropical Bath Body, Smiles, April, Trav, awesome job. Next question. All right. That was basic care. It sure was. Let's go into our next question. Let's go back to med administration for 200. This is another very popular thing that's going to be asked. All right. Medication administration, specifically the administration of eye drops. Make sure you know it. All right. So this is for 200 points. The nurse is providing instructions to a client who will be self-administering eye drops. To minimize systemic absorption of the eye drops, the nurse should instruct the client to take which action? 1. Eat before instilling the drops. 2. Swallow several times after instilling the drops. 3. Blink vigorously to encourage tearing after instilling the drops. Or 4. Occlude the nasolacrimal duct with a finger after instilling the drops. What is our answer? Remember, go back up and read what that last question says, just so you can remind yourself of what you have to answer. To minimize systemic absorption of the eye drops, the nurse should instruct the client to take which action. Okay, so that's what we're looking for. We're not looking for the correct way to instill drops. We're not looking for none of that. We're looking for the answer that specifically is going to help minimize systemic absorption. And whenever you see systemic absorption, that means whatever drug medication is absorbed into the body systemically. So it's not just going to go to a local area. It's going to go throughout the whole body. Okay, so how can we minimize that drug being introduced to the whole body and just kind of keep it local to where we want it? What action can we do to make sure that happens? All right, let's go ahead and look and see what that answer is. And the answer, was this for 200 points, is what is 4? Occlude the nasolacrimal duct with a finger after instilling the drops. Okay, so this, that. Do y'all watch Keeping Up with the Kardashians? Have you ever seen them cry when they got makeup on? And they gotta they put the tissue right here. If they don't want to cry, they put the tissue right here. They'd be like, literally, Scott and Kanye and North and everybody else and Chris and Caitlyn Jenner, they go right here. All right. And even though they're not doing that to, minimize systemic absorption of eye drops, this action right here is going to occlude the nasolacrimal duct. Okay, that's where your tears come from. All right, so if you put eye drops in and you don't want it to absorb systemically, then you want to put it in there, and then once again occlude the nasolacrimal duct so it can just stay locally. Okay, it's almost like you're plugging the drain. All right. Y'all don't laugh at me. A lot of people were stuck between 3 and 4, which is funny because they said the opposite things. So 3 was like blink vigorously, all right, to produce tears, okay? But once again, that's the opposite of what you want. Blinking vigorously is gonna basically send it and push it into that lacrimal duct so it can be absorbed systemically, all right? The opposite of that was to occlude it, okay? So funny that a lot of people were between 3 and 4. Those are opposite answers. And remember, test taking strategy. Whenever you see, especially with multiple choice answers, whenever you see 2 of those choices that are opposite or alike, more than likely it's going to be one of them. But if it's opposite, then they can't be both. Obviously, if A says turn on the lights and B says turn off the lights, can't be both. Okay. All right. let's go ahead. Did I give points? I did not. So who got what is for first? A lot of people got what is for. So proud. I'm like a proud mama. 4 was, I think, Mary. Mary S. I keep saying SWV. That's not what it says. All right, Mary. Where'd you go? SWBC. You were on the scoreboard with 200 points. SWBC. SWBR. And when you can sit on me. Who sang that song? Let me know. All right, Mary, you're on the scoreboard with 200 points. Great job. Who else got what is for? It's Callie. Go back. Something happened where it just completely. Okay, yeah. It's Callie, name 42, Buchanan, TGDC, Corey, Sing, Smiles, Lydia, Vicky, Kiss My Dimples, Blessed Favorite Beauty, Trav. Wait, no, that's at 3. E-Love, Wallflower, change it to what it's for. Usually I say don't change your answers, but I'm glad you changed your answers to the correct answer. Kiss My Dimples, I was stuck between 3 and 4. It's funny. All right, great job, guys. Let's go into our next question. What was that? Something for 200? Med administration for 200, I believe. Next question is, let's go back to skills. Skills for 300. Ooh, listen. Chest tubes will have you in a chokehold. Okay? Y'all, let's just do the question. Because maybe it was just me. Because chest tubes always had me in a chokehold. And we'll talk about it. All right, skills for 300. The nurse is monitoring the chest tube drainage system in a client with a chest tube. The nurse notes intermittent bubbling in the water seal chamber. Which is the most appropriate nursing action? 1, check for an air leak. 2, document the findings. 3, notify the primary healthcare provider. Or 4, change the chest tube drainage system. We're going to go back. What is the most appropriate? It was the most appropriate nursing action. Okay, let's go back a little bit so we can get some facts. We're monitoring a chest tube drainage system, and we note intermittent bubbling. Remember I said whenever you see, especially when you see adjectives before a certain word, please note the adjective, okay? The nurse notes intermittent bubbling. Y'all know what intermittent means? Comes and goes. Okay, I was trying to think about the meaning of intermittent. But not constant, not continuous, It comes, it goes, it comes, it goes. Okay, that's what intermittent means. So intermittent bubbling in the water seal chamber. It's not continuous. Sometimes you see it, sometimes you don't. What's going to be our most appropriate nursing action if we know intermittent bubbling in that water seal? Okay. What is going to be that answer? Wait. Kunda, don't make me laugh. Okay, so when I see Trav, I'm assuming it's you, Kunda. Gotcha. No problem. All right, let's see what the answer is for this one. Chest tubes. And if you have not learned about chest tubes yet, aren't you glad you're here? Because I'm telling you, when you get to that part, and I think with fundamentals or med-surg or wherever you learn it first, you can be like, oh, thank God Sam went over it, because this is annoying. Let's go ahead and see what the answer is. And the answer is, drum roll, please. And the answer is, it's corn. Tell you all about it. It's got the juice. The answer is, what is 2, y'all? Document the findings. This is normal. It's normal. All right. Before I get into it, let's see who got it right first. Who said what is 2 first? I'll tell you all about it. You got the juice. It's got the juice. Dum, 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 dum. It's cone. Not corn, but cone. A lot of people said what is one, which was like check for an air leak. I see why you said that, but we're going to get into it. The answer is actually what is two. Okay, Tiara88_Z. Tiara88_Z. You're on the scoreboard with 300 points. I love to see it. Who else got what is two? Kiss My Dimples, Nurse Crystal PN, Corey Estoff, Ben Takib, Elizabeth Iman, Greenhouse, it's Callie. It's just cone. That's funny. Don't make me laugh. All right. So yes, the answer is what is to document the findings. This is how, like I said, chest tubes had the girls in a chokehold, and by girls I mean me. So if it's something that I know I struggle with, I'm always going to double down just in case. Not saying my struggles are your struggles, but just in case you need a little bit more, a little bit extra to comprehend and really retain this material. I like to double down just a little bit on those things. Okay, chest tubes is one of them. Bubbling in the water seal chamber is caused by air passing out of the pleural space into the fluid in the chamber. All right, so remember I said about those adjectives. Pay attention to those adjectives. Intermittent, which is another word for not constant. Okay, intermittent bubbling is normal. Okay, it indicates that the system is accomplishing one of its purposes, which is to remove the air from the pleural space. Okay, it's doing its job. All right, how I remembered it is intermittent in is the same as normal. Like the in, even though it's not the letter N, but in, intermittent, normal. That's how I remember it. Intermittent bubbling is normal. The in and the N. Sounds the same, so I'm just going to remember it that way. Worked for me. Don't know if it'll work for you. If y'all have any other type of mnemonic device, something that y'all have, maybe learn that helps you remember the difference between what is normal versus what is abnormal within a chest tube, please share. Sharing is caring, okay? Once again, intermittent bubbling, normal. Now, continuous bubbling, all right, or constant bubbling, especially during inspiration and expiration, that indicates an air leak. Continuous, just bubbling all over, that indicates an air leak. Okay, now if that occurs, then yes, that must be corrected. So whatever it is your intervention is, it needs to go towards correcting the continuous bubbling. That is not normal. That needs to be corrected. Okay, notifying the primary healthcare provider and changing the chest tube drainage system are not indicated at this time, especially if it's, once again, intermittent. That was the question, intermittent. Now that we know that intermittent bubbling is normal and constant or continuous bubbling is not normal, make note of that. And then, like I said, if you have not learned chest tubes, you need to go over it, because there's a lot of other situations and scenarios within like the chest tube world where they're asking you if it's normal. So thank you, Bentakib. Seal, a kiss from a rose, whatever, however you want to remember it, that seal. It goes up and down in the, oh, that's so cute, Bentakib. A seal goes up and down the ocean. Oh, you got that? Oh, okay, I see what you got. It goes up and down the ocean. That's cute. I like that. Shanice, what if there is constant, but we just talked about that. I hope that answers your question about that. That was cute. All right. We'll have some more questions, and I'll do some more questions, especially in my stories about chest tubes, water seals, bubbling, all that stuff. It sounds like champagne, okay? Bubbles and seal, all that. Perfect. All right, if you have any questions, please drop them down below, but we'll definitely make note of that, okay? Next question. That was What was that again? 300 for 300. Okay. Let's go back to skills. This is another thing. This one didn't really have the girls in a chokehold, but if you don't know what you're doing, it will. Let's go back to skills. Mind you, everything that we are going over you need to know. Whether you are in practical nursing school, RN school, it doesn't matter. If you're about to be a nurse, if you're studying to be a nurse in whatever capacity, credential, whatever, you need to know these things. It doesn't matter if you don't want to go to the hospital. It doesn't matter. You have to know all these things so you can pass your class, so you can pass your ATI, your capstone, your NCLEX. You need to know it, commit it to memory, and comprehend it. Because I promise you, on the NCLEX, questions are not as simple as what 1 + 1 = 2. It's not that. It's going to really make you critically think. So you have to be able to stair step it when it comes to making these connections between different concepts. All right, so skills for 200. The nurse is preparing to suction a client via a tracheostomy tube. Okay, that says tube, right? Yes. The nurse should plan to limit the suctioning time to a maximum of which time period? 5 seconds, 10 seconds, 30 seconds, 60 seconds. Let's run it back. We're preparing to suction a client via a tracheostomy tube. Tracheostomy tube, right here. The nurse should plan to limit the suctioning time to a maximum of which period? And then I'm going to ask y'all, why are we limiting the suction time to a maximum of which time? And they said maximum got me. Don't let it get you. Don't let it get you. Okay? Don't think too much into, maximum versus minimum. Because is there a minimum? Is there a minimum? Remember, the interventions and the actions that you're doing is to make sure that you are, in this specific example, you are suctioning this for whatever, to clear secretions, to do whatever, to make it easier for that client to breathe. Okay, so there really isn't a minimum. It's whatever you have to do in order to get those, secretions out. However, there is a maximum, because if you go over that maximum, remember, you're suctioning here. Think about your ABCs: airway, breathing, circulation. If you're suctioning out where there's breathing at the same time, let's think about it like holding your breath. What is the maximum time someone can hold their breath? Think about it like that. Okay, specifically this trach person. I'm not talking about you. I'm not talking about Michael Phelps or swimmer guy. I'm not talking about that. What is the maximum time before oxygenation is affected? Okay. All right, 5, 10, 30, or 60. What is going to be our answer? A lot of people said B. That's what I said too. We're either all wrong or all right. And the answer for skills for 200 is, what is B? 10 seconds. That's what I'm talking about. Let me go back. Scrolling up to see who got this one first. Okay, X Pixie, I just scrolled up and saw your comment. You passed your head to toe assessment. Right? One more time. Sorry, I had to take a screenshot. All right, first person to say what is 2 or what is B, whatever, it's Callie. All right, welcome to the scoreboard. It's Callie. You have 200 points. All right, 200 points for It's Callie, who also got what is B or what is 2. Smiles, Buchanan, I Am the Ambitious One, Mary, TGDC, Priyanka, not Trav, but Kunda, something. Faith Hunker, Ida, Red Taurus, Corey, Nurse Crystal, Bentikib, Tropical Bath Body Works. Oh, well, I added that last word, sorry. Ash the One, Blessed Favorite Beauty. Okay, Buchanan, because ventilation, period. Buchanan, not to cut off oxygen source. It's like suffocating them. Thank you. Yes, holding your breath is a good rule, too. It'll dry out the throat. I have a trach kit at home. All right, so let's go ahead and read the actual rationale. But great job to everyone that got what is B. If you didn't get what is B, now you know. Okay, 10 seconds is going to be the maximum time. All right, just because you're suctioning out the secretions and their oxygen. You only want to do that for max of 10 seconds. Okay, it says hypoxemia. All right, which means low oxygen in the blood. That can be caused by prolonged suctioning, which stimulates the pacemaker cells in the heart. A vasovagal response may occur, causing bradycardia. The nurse must pre-oxygenate the client before suctioning and limit the suctioning pass to 10 seconds. Okay? So yes, that's very important. The nurse must always pre-oxygenate the client. So it's like you want to give them, you know, you're about to suction and cut off basically their like oxygen supply. So you want to it says pre-oxygenate. So you want to give them like an extra dose. Right before you do, you want to give them an extra dose of oxygen. Just go ahead and just breathe all that oxygen in. It's the equivalent of like saying take a deep breath before trying to hold your breath and do something like going underwater or something like that. It's the equivalent of that, just with a tracheostomy client. Great job, everybody. A lot of people got that one, so very, very proud. Make sure you do not forget that, because I promise it will come up. What's next? Oops. Okay, so let's go back. I chose the wrong. Don't pay attention to that question. I hit the wrong thing. Okay, next one. Basic care. Boop. Basic care for 300, everybody. All right. Ooh, since we're on tracheostomies, let's go ahead and keep it going. Basic care for 300. The nurse is monitoring the respiratory status of a client after creation of a tracheostomy. Which coexisting condition in the client may cause an inaccurate pulse oximetry reading? Which coexisting condition in the client may cause an inaccurate pulse oximetry reading? So 1, fever. 2, epilepsy. 3, hypotension. 4, respiratory failure. I want you to really think about this one, okay? What may cause an inaccurate pulse oximetry reading? Think about pulse oximetry, what pulse oximetry is actually measuring, and then think about what could possibly disrupt that to give you an inaccurate result, okay? Yeah, do that. So let's go ahead and I'm gonna let y'all answer, and then we are going to figure out what the answer is. Will y'all see me smile like this? Because I'm looking at it. I'm looking to see who gets it right, who gets it wrong, and who's like changing their answer, not changing their answer. All right, let's go to the actual answer. 1 second. And I'm interested to see why you guys put the answer that you put and the rationale behind it. Okay, so whatever your answer was, tell me why. Or comment why you think it's that. What's this again? Basic care. Okay, basic care for 300. Hold on, look to see what y'all saying. Faith Hunter said fever because it can throw everything off. All right, let's go ahead and look at what the answer is. And the answer is, drumroll please. What is 3? Hypotension. What is 3? Hypertension. Hypotension. Okay. All right. Rationale. It's okay. This one had me in a chokehold too. I got it wrong. I said 4 personally. Personally, I said 4, but the answer is 3, and we're gonna go into why. All right. So hypotension, shock, or the use of peripheral vasoconstricting medications. They may result in inaccurate pulse oximetry readings as a result of impaired peripheral perfusion. Jeff said, dang it. It's okay. Like I said, I'd rather y'all get the questions wrong with me than on the actual NCLEX. You agree or disagree? Right. So, impaired peripheral perfusion. Remember pulse oximetry. What is that actually? What's blocking options? Can't see for the comments blocking options. If you are having difficulty seeing all the options, try to minimize and scroll down on the chat, on the comments. All right, so yes, when you're measuring pulse oximetry, remember that it's measuring the amount of oxygen in the blood. So your perfusion, especially peripheral perfusion, has to be accurate. I mean, not accurate, it has to be adequate, okay? If there's anything that can cause, especially like a drop in BP, that's going to also cause a drop in your perfusion, okay? Fever and epilepsy, that would not affect the accuracy of measurement. In my mind, when I saw epilepsy, I was like, as in like they're currently having a seizure, and so like maybe it's hard to keep the little pulse ox thing on, but once again, that's not what the question said. It did not say anything about them having an active seizure. So you got to correct yourself when you try to go and you try to insert things and specific like measures that are not that were not given to you. If it's not given to you, it's not important. Then this is respiratory failure, which is what I picked at first, but that's not the answer, and here's why. It said it would not affect the accuracy of the measurement, although the readings may be abnormally low. This was a little bit tricky, okay? So remember, the question's asking you which one would affect the accuracy of the measurement, not what would affect the measurement, period, okay? Does that make sense? Oh, good night, Lauren. Thanks so much for joining me. Make sure, Lauren, you passed your NCLEX, so you don't have to come back to nursing school. Everybody else, I'll make sure y'all sign up for back to nursing school. So yeah, you got it? Okay, perfect. Just want to make sure y'all got that one. Makes sense. Perfect. All right, next question. What was that? Let's go to skills for 500. We're just staying in the family. All right, skills for 500. This is the last question of the afternoon or the evening. The nurse determines that a client with a tracheostomy tube needs suctioning if which finding is noted. Oh shit, I didn't put points. My bad. My bad. Let me go back. My bad. Answer that. I'm gonna scroll back and see who got those points. Scroll. What was the answer again? What is 3? Okay, it's Callie. It's Callie. You were the first person. Damn, what was that? I'm trying to remember what those points are. Hold on one second. Keep answering that. Wait for it. That was 300. All right, it's Callie. You have 200 points already. You got that last one. You were the first person to answer correct on that last question. So you now have 500 points. Awesome job. All right, now you can answer this one, y'all. All right, the nurse determines that a client with a tracheostomy tube needs suctioning if which finding is noted. 1, bronchi are auscultated. 2, pleural friction rub is heard. 3, fine crackles are auscultated. Or 4, pulse oximetry reading is 96%. The nurse determines that a client with a tracheostomy tube needs suctioning if which finding is noted. now I'm scrolling back down to see who got this one. All right. What are you guys saying? I'm getting like equal parts 1 and equal parts 3. So 1 is Ronkai and 3 is fine crackles. Okay, a couple different ways where you can how you can tackle this question. Okay, one of the most important skills, especially within fundamentals, and they term it as a skill, okay, but this is right along the lines of assessing vital signs. Okay, this is basically within like your assessments. Okay, this will be part of a respiratory assessment. Okay, so you have to know your lung sounds. You got to know your whenever you see the word adventitious, you'll see adventitious breath sounds, and that basically means abnormal. Okay, adventitious is the same thing as abnormal. You got to know your abnormal lung sounds, how they sound, and what situations you could expect to hear those. Okay, if you hear Ronkai, then what does that mean? What kind of what would cause Ronkai to be heard? What would cause pleural friction rub to be heard? What would cause fine crackles? So you have to know the cause of these things, and then you also have to know what they sound like. Okay, so let's go ahead and figure that out. Skills for 500. What is our answer? And the answer is, drum roll please. What is 1? Ronkai are auscultated. Ronkai are auscultated. All right. Who got what is 1 first before I forget points? It's cone. Let me tell you all about it. It's got the juice. It's got the juice. I am the ambitious one. Let me make sure. Yup. Okay, I am the ambitious one. Got 1 first. Awesome job. I am the ambitious one. And you have 500 points. Look at you. Ooh, who else got it? AJ ran it up. Buchanan, Mary, Lydia, Smiles, Trav / Kunda, Sangeeta, Bentakib, Mrs. Jones, Red Taurus, Bears a Baby. Bronco. I think Shanice meant yeah. Shanice, Ronkai, and I'm not sure what you're trying to say. But awesome job. Yes, the answer is Ronkai are auscultated. Okay, so presence of Ronkai. That is an indication that there are secretions in large areas. Okay, so if you hear Ronkai, secretions. All right, so remember, tracheostomy client, you would need to suction a tracheostomy client if there are excess secretions. Okay. I'm gonna ask y'all another question. I'm not gonna do that because I don't know if y'all took pharmacology yet. I might do it. Depends. Okay. But yes, whenever you have a tracheostomy client and they're needing suction, more than likely it's because they have excess secretions and you want to get that out so they can breathe better. All right. What would cause secretions? No. What sound with secretions, like especially in large areas? What sound would let you know that there are secretions and you need to get them out? Ronkai. Okay. So if you hear Ronkai, I need some suctioning equipment. Goes hand in hand. The client requires suctioning, especially if they cannot expectorate. All right. They can't clear and break up those secretions and cough them up. If they can't do that by themselves, then you're gonna have to suction it out. a pulse oximetry reading of 96%. That's an acceptable reading. So that's fine. That's not going to let us know that we need to do anything. A pleural friction rub. That's indicative of inflamed pleural surfaces. Words mean things. It's okay. So pleural friction rub means there's something going on in the pleural space. And then fine crackles. Those are indicative of air moving into previously deflated alveoli. All right, now, remember I said whenever you see adjectives for those other words, more than likely it's another type of adjective to go with it that means something else. So not only do you need to know fine crackles, and even though I didn't see this in the answer choices, you also need to know what would indicate, what would cause, no, you also need to know how coarse crackles sound and what those are indicative of. All right, fine crackles, I don't mean fine like, ooh, she's fine. Like, I mean like very like small, minute. Fine crackles are indicative of air moving into previously deflated alveoli. Coarse crackles, which is a little bit more rough, okay? Those are indicative of, actually I don't know, so let's look at it. Look at and coarse crackles. Coarse. And not coarse as in C-O-U-R-S-E. Coarse as in C-O-A-R-S-E. Coarse crackles. They are, who's gonna tell me? Coarse crackles are what? And I am the ambitious one said pneumonia, COPD. Let's look at, okay. Coarse crackles are louder than fine crackles. Okay. They're more low pitched and they're longer lasting. All right. They indicate excessive fluid on the lungs. Okay. So anything else you can think of that can cause excess fluid. Somebody said pneumonia. I love it. Chronic bronchitis. Aspiration. Remember we talked about positioning. Okay, it can cause something that can cause aspiration. If for some reason, you hear coarse crackles, especially in a patient that has maybe like a tube feeding, there is fluid on their lungs, especially if they don't have like pneumonia or any type of other coexisting morbidity that would, or diagnosis that would explain fluid on their lungs, then you have to put two and two together. Like, oh, it sounds like they aspirated. See where I'm going as far as the clinical judgment and the critical thinking? You got to know these things. Heart failure, especially congestive heart failure, because there's different types of heart failure, but specifically the one that has fluid. So congestive heart failure. Absolutely. Great job for knowing that. Okay. Did I put my points? I did put my points. Perfect. Makes sense? I'll do a post on like adventitious breath sounds. That's also going to be a part of your week 1 back to nursing school lesson plan. Since we're doing like clinical skills, we're doing procedures, basic care, the basics, but more so the skills. I want to make sure that when you do your skills check off, which is usually within fundamentals, you're good. Okay. Well, I think we have a tie between I'm the ambitious one and it's Callie. So we're actually going to do one more. And this is it right here. All right. Med admin for 300. The nurse is preparing to administer medication to a client via a PEG tube, which is percutaneous endoscopic gastrostomy. There we go. PEG tube. Which medication prescription should the nurse question? Now remember, whenever you have to question something or clarify, it means you as the nurse, you're looking at something that does not belong, does not fit, it should not be happening, or this looks like a mistake waiting to happen, okay? So you got to clarify, you got to ask the question. So which one of these medications would not or should not be administered via PEG. That's basically what it's saying. Okay, 1, furosemide 20 milligrams via PEG tube daily. 2, digoxin 0.25 milligrams via PEG tube daily. 3, isosorbide mononitrate, 30 milligrams via PEG tube daily. Or acetaminophen elixir, 650 milligrams via PEG tube daily. Via PEG tube every 4 hours as needed for temperature over 101 degrees Fahrenheit. Which medication prescription should the nurse question? Which one does not belong as far as administration via PEG tube? Let me look at what y'all are saying. All right, so we are looking for medications that can't be administered via PEG tube. Okay, let me see what y'all saying. A lot of people saying what is 2, which is the digoxin. Let me see. I'm getting lots. What's the difference between a PEG tube and a G tube? I'll tell y'all. All right, let's go ahead and see what that answer is. All right, and the answer is I ain't gonna lie, I don't know this one. That's funny. The answer is what is 3, isosorbide mononitrate, 30 milligrams via PEG tube daily. That's a medication that cannot be administered via PEG, and here's why. The process for administration of medications via PEG tube indicates, well, honestly, via any tube, indicates that you have to check for bowel sounds. All right, also take those bowel sounds in all 4 quadrants, assess the residual, and then confirm placement, the PEG tube placement, prior to administering any type of medication. All right, there's a specific way to check the placement of a PEG tube. You gotta insert a small amount of air and then listen to 2 finger breaths, I think away from the umbilicus, and listen for a swooshing sound, and that lets you know that the PEG tube is where it needs to be. Okay, you check your residual by aspirating, taking a large syringe and aspirating, and whatever is aspirated is your residual. It can't be over a certain amount, but you do put that residual back. That is important. You put that residual back into the patient. Okay, so after you do all that, the nurse should crush each medication and then mix with tap water. And then you're supposed to administer the medications one at a time, followed by a flush in between each medication. Okay? Let me tell you something. Doing this is annoying. It is annoying, especially if the patient has 30 morning medications, and especially if you have JACO or the state looking at you and making sure you do all those, the one pill. You got to crush it up real good with that silent crusher thing that's not silent at all. I don't know why they call it that. Crush it and administer it. Now, there's certain medications that you cannot do this with, okay? And those are enteric coated tablets. Okay, sustained release tablets, or XR, extended release, those things. And isosorbide mononitrate is one of those medications. It is a sustained release tablet. Okay, Yeah, it's a sustained release tablet, so you cannot administer something like that via peg tube, because that is not, those types of tablets are not to be like crushed. And then, like I said, the controlled release tablets like the XR, extended release, blah, blah, blah. And capsules, those should not be crushed because their mechanism of slow release is interrupted. Okay, now, correct me if I'm wrong, because I feel like it changes, but as far as like capsules go, if it's not extended release but the medication is in a capsule, you can open that capsule and pour the contents, within it. At least that's what I learned. I'm not sure. Let me know if you've heard that, learned that, whatever. That's what I learned in 2014, but I don't know if it's changed. I do not know if it's changed. If that's still something that you can do. Kiss with Dibble said yes. Okay, I just want you to just make sure. But the big thing is that if it's extended release, if it's enteric coated, sustained release, all those things, those cannot be crushed. It'll ruin the fact that it's a time release or slow release type medication. Okay? So, who got this one first? A lot of people said digoxin. You can crush digoxin. You can totally crush digoxin. So who said what is 3 first? Who said what is 3 first? A lot of people chose 2, but that's okay. Lolo Elimini. The first person that got what is 3. Esterly got it. Kiss My Dimples got it. Awesome job. Do you or anyone have any school reference in Los Angeles? I don't live anywhere close to the West Coast. Google. I would do a quick Google search of whatever type of school you want to go to, or program within your specific area. Was that it? Let me see. All right, yeah, not a lot of people got that one, but we're not there in class yet. That is perfectly fine. So when y'all do get in class, y'all be like, we went over this already. She's familiar with this. Thanks. While everybody else is like, what? I don't get it. You can be like, we learned this 2 weeks ago with Sam. Okay, that's what I want y'all to do. All right, great job, Elimini. Okay, so 500 points. Wait, let me go back to where you are. Ooh, Esterly got it, and Lolo. So Lolo, you on the score with 300 points. The winner of tonight's game, we actually have a tie. I'm the ambitious one, and it's Callie. Y'all still here? I'm the ambitious one, and it's Callie. Both of you guys have 500 points. Great job. Everyone that was on the scoreboard, awesome job. First of all, if you've participated at all, claps to you. Give yourselves a round of applause. You are one step closer to getting this material and comprehending it, okay? Especially with, we do these Jeopardy reviews every week, every Thursday. It is free to do. It's a free, fun review. So if you are the type of person that isn't or doesn't mind studying in a group, this is the place for you, especially because we give away free stuff every week. It's just the easiest thing. You guys are all awesome. Absolutely. I'm the ambitious one. Did you win the Ultimate Nursing School bundle already? And if you did, do you have the NCLEX Arcade? So you win one of them. Okay. Queen Jillian, my NCLEX says, I'm so nervous. Oh my gosh. Good luck to you, Queen Jillian. I remember you. No, you'll be fine. You will. Thanks, Lolo. Yes, you will do great. I remember you answering. But yeah, let me know how everything goes. DM me. We are all rooting for you. You will do fine. You will do great. Okay, let me know 2 days after you take it. Like, oh Sam, I got my nursing license. Just send me that quick DM because I know it's coming. I know it's coming. Okay, I am the Ambitious One. You said you purchased the bundle. I don't have arcade. Perfect. Congrats. You won NCLEX Arcade. Awesome. So send me a DM with your full name and your email address so we can go ahead and get that prize over to you. Okay, that NCLEX Arcade it comes with 6 video replays. Each of those video replays are about 3 hours. So you have 18 hours of video review. And it's basically us going through questions that are arcade style and just, themed, but still NCLEX style questions, just in a fun, like, arcade theme. And it also comes with a supplementary workbook. So every question that we're going to be going over, you can access the question and the answers and the rationale within that notebook or within that workbook as well. It is digital. Both of them are digital. So congrats, you just won that. That is $59 regular price on our website, but you just won it for free. Congrats. Awesome job. It's Callie. If you're still here, same question goes to you. Do you have the Ultimate Bundle and or the NCLEX Arcade? Okay, I am the Ambitious One. Thank you. Yes, that will help as I prepare for my NCLEX next month. Woohoo! Yes, it will. Absolutely. Lauren left already, but she was just saying how NCLEX Arcade helped her pass, and she recently passed like a week ago. Okay? Lauren's been coming to NCLEX Jeopardy for like 2 years, getting ready. And right when she had her NCLEX, it was nothing. She was like, it's nothing. Kelly, I don't have either. All right, so you get the Ultimate Nursing School Bundle. Congratulations to you. NCLEX is in 2 weeks. Perfect. Awesome. Oh, I just love all these NCLEX that are coming up. All right, so make sure, same thing to you. It's Callie. Send me a DM with your first name, last name, your full name, and an email address so we can go ahead and give you your prize. All right. Congrats to everybody again that played. Whether you placed or not, if you answered those questions correctly, awesome job. You're on the right track. If you didn't answer questions correctly, or if you answered more wrong than you did right, do not freak out. Do not let that get you discouraged, okay? This is why we do these weekly reviews, so that you can kind of assess yourself and see where your strong points are, where you're weak, your areas of weakness, so you can go back and work on it. Okay, I know for me, I took NCLEX like 8-9 years ago. Was September? It's 2022. Literally like 8 years ago. I passed my, I graduated August 6th, and I took my NCLEX like September like 8th or something. Wait, today's 8th. Oh snap, it is literally my 8-year nurseversary. I passed my NCLEX 8 years ago today. Let me make a post. But yes, even 8 years later, I still play NCLEX Jeopardy, even with y'all, just to make sure that I kind of know specific things that either I'm helping you guys learn, or if I'm just, refreshing my own memory. And if it's something that I don't know, for example, chest tubes, I want to go back and I'm just going to brush up on it, refresh, do whatever I need to do, because I know, okay, on the practice test, I didn't do so hot. So let me go ahead and adjust my study plan, my study strategy to include that, so I can just get better at it. No big deal. That's just the game. That is the game of trying to pass the NCLEX. Okay. Thank you guys so much. Have a cone-tastic day, right? It's cone. I'll tell you all about it. It's got the juice. It's got the juice. Do you want to sing the song? You hear me? No. Babe? Nope. He can't hear me. He said he was going to sing us a musical selection. Babe, are you still going to sing us your musical selection?
It's cold. It's got the juice.
It's got the juice. That's it? All right, y'all. they love your song. They want it on like iTunes or Spotify immediately. Been to get my pass last month, but I'm still gonna come on here, right? It's such a fun review, right? It's such a fun review. Everything changed. You gotta hit that note. Everything change. All right. Yeah, please don't make me laugh. All right, guys. I'm the ambitious one. It's Callie. Don't forget to send me that DM so I can get y'all gifts and prizes to your email addresses. Everybody else, if you have not signed up for Back to Nursing School, it is free. If you came to Camp Nursing School or did not come to Camp Nursing School, it's very similar. We just have different topics. Instead of that camp theme, we just have back to school themes. So it's very like collegiate, just academic, all that great stuff. But instead of back to school, it's back to nursing school. So we're still going to talk about all those things that you guys need. So fundamentals, as well as those specific things, whether or not you are in your first semester, second, third, doesn't matter. We're specifically going after, like I said, week 1 is nursing skills, basic care, med administration. Week 2 is med surg and pathophysiology 1. So we'll be discussing like cardiac, endocrine, and I think neuro. Definitely cardiac and endocrine then, though. Week 3 is maternity OB. And then week 4 is the growth and development section of pediatrics. All right, that's what we're doing for this month. Okay, those lesson plans, those topics are going to change every time we do it, just to make sure that we are covering everything. Yeah, make sure you go to the link in my bio or check out my stories to get that link. Okay. Make sure you download the NurseSam app so you can get all your Back to Nursing School study supplies. So your Ultimate Nursing School bundles, your NCLEX Arcade if you're about to take NCLEX. If you're taking the T's, you can get your T's bundles. That's what I recommend. And if you have any questions, make sure to reach back out. All right, like I said, we do these every Thursday, even though we do a little bit via live. The full 25 questions are going to be on the NCLEX Jeopardy mobile app. Well, the mobile game of the NurseSam app. So if you download the NurseSam app, you'll be able to play all 25 of those questions that change weekly. Okay. Hi, I'm new. When is the next live session? For NCLEX, it's going to be next Thursday. I'm doing it every Thursday at 7. And even if I can't do a live session, I at least put the session in my stories with the interactive button so you guys can actually, quiz yourselves and then read the question just like this, and then select the answer in my stories, and then you'll be able to see the rationale and stuff like that. So practice makes progress. That's the name of the game. All right, guys. Thank y'all so much for joining me. I'm gonna go eat dinner and go to the pool. All right, y'all. If you have any questions at all, please let me know. If not, I will see y'all next Thursday. If you want to come to the Tuesday tease version of Jeopardy, then I'll see y'all Tuesday. All right. Our first pep rally / study hall for Back to Nursing School is going to be on Sunday at 6 p.m. Eastern Standard. So make sure you attend that. We'll be going over everything you need to know to prepare yourself for clinical rotations. Okay? All right, y'all. See y'all later. See y'all then. Good evening.